Aaron Rodgers shared photos of his rehabilitation recently on his Instagram site. The caption reads, 3 weeks into the rise to recovery, which implies he is certainly on the rebound back to playing for the Jets. It appears he is making steady headway into his comeback recovery. As we can see from these images he has shared, he's engaging in a number of physical therapy and occupational therapy type exercises. From here it appears that he is at least using the crutches for at least part of the day and to offload some of his weight. It's likely he is doing some partial weight bearing by way of the crutches. He did state that one of his next big goals is to be done with the crutches altogether. Here it appears he is undergoing kinesiology tape or K-tape therapy. K-tape is very popular in the sports and rehab world as it can produce force, stretch, and support in certain areas. These many uses for this tape, and indeed in the hands of a trained professional, can offer increased and specific therapy to key areas. While it's hard to decipher from a still image what is happening here, it's possibly a support or stretch of his lower leg given the rotation of his foot. It looks as if it's in an supinated position with the tape on key areas of the bottom of the foot, such as the tendons that control the distal half of the foot. This tracks up the inner ankle and leg to end just below his knee. It's possible that therapy applied traction to the tape along the way to stretch the strictures as appropriate for him. Once in place, K-tape can remain for several days. It can be adjusted over a period, offering a cascading therapeutic effect. We can also see his operative site has a small dressing still. It's unclear if there were or are any sutures here. Next we see him being examined perhaps by his surgeon Dr. Lilitrache. His surgery was performed very soon after his initial injury. This does give the tendon a good chance of healing well without the chance for edema to set it. In this photo, Mr. Rodgers appears to be picking up marbles with his feet and toes. This practice is common in the occupational therapy realm as it commands finer motor movement and recruits and trains very tiny muscles. This type of therapy is very different from the larger range of motion exercises he is also likely doing. Whereas you also want the larger, stronger muscles to be trained, it is important to consider the smaller muscle groups as well. This sort of therapy also helps to accelerate healing in some cases, as it is quite intentional and can be done away from a splint or boot. It's unclear how often he is doing this type of work, but it's good to see that they have this as part of his rehabilitation plan. Finally, in this photo it appears Aaron Rodgers is training while utilizing a likely blood flow constriction device. Rodgers has made mention of this therapy in the past, and it can be a part of his overall recovery plan. These pneumatic constriction devices carefully reduce blood flow and allow the limb to train under stress circumstances to stimulate healing and blood flow. This sort of therapy has been used in limb trauma recovery programs before. This can also help reduce overall muscle atrophy. It's helpful that Aaron Rodgers has released these photos to the public, as it likely communicates a message of hope, inspiration, and a look towards the not-so-distant future where he can rejoin the Jets on the field once again. We will continue to monitor this situation and provide updates as they develop. Please consider subscribing, and thank you for watching.